let's go, let's go, let's go. Hi guys, my name is Tutu and you're welcome to my YouTube channel. If you're a new subscriber here, you're welcome. And my old-time subscribers, thank you so much for sticking with me. I love you so much. Today we're going to be discussing a very important topic which has to do with health. It is ovarian cysts, and I have right here my amazing Doctor Dooshima that is going to enlighten us more on ovarian cysts, because I myself suffered ovarian cysts a couple of years ago and I remember how demanding and stressful it was. So she's basically going to enlighten us a bit on ovarian cysts. Dr. Dooshima, nice to have you here.
Thank you so much. Thank you for having me in here. I'm really elated and glad to be here. So where do we begin?
Let's begin anywhere.
Okay.
Well,
so
I think people would like to know what ovarian cyst is itself. What is it?
Okay. So ovarian cyst, let me divide it into two. Ovarian cyst, ovary and cyst, right? It's two words joined together, ovarian cyst. So a cyst is a fluid-filled sac, while an ovary is a structure that houses the egg in a female.
Okay.
All right. So when you say an ovarian cyst, then you say it means a fluid-filled sac that arises from the ovary. So basically, that's what ovarian cyst is. Found only in females, so no guy should come and tell me as ovarian cyst. Yes.
Okay.
It's really wide because you have different types of ovarian cysts, so all of them have different causes, right? So the most common ovarian cysts are what you call functional cysts, and they are divided into two. We have the follicular cyst and the corpus luteum cyst. Now, all of this arises from menstrual cycle, right? So in a female, you have approximately 28 days circle, right? And in the middle of that circle, you have what you call ovulation. So normally, when the ovulation is about to occur, what happens is that an egg is released from the ovary, right? So what happens is that if that egg fails to be released, a cyst will form.
Okay.
So that's when you have your follicular cyst.
Okay.
Then we also have the corpus luteum cyst. Now, when this egg is released, right, and it gets fertilized, what happens is that a cyst is formed after that fertilization just to support pregnancy, right?
Yeah.
And then after a while, it resolves, that cyst. That's what we call the corpus luteum cyst. So in some individuals, this cyst fails to resolve, and that's what happens when you have a cyst during pregnancy. So you now have an ovarian cyst during pregnancy. Then we have other cysts. We have a dermoid cyst. We have polycystic ovaries, when you have some people say they have PCOS.
Okay.
Then we also have some cysts that can be cancerous, carcinoma.
Okay, so you mentioned cyst in pregnancy.
Yes.
So are cysts in pregnancy is usually deadly?
Okay.
Can it affect a child
Okay.
or cause miscarriage?
Yes. Okay, so they say disease no dey kill man, abi? Yeah, but then yes, cysts can be deadly if they are not picked early.
Okay.
And we what we call ovarian accidents.
Okay.
Yes, that happens when a cyst ruptures. And then if the cyst ruptures, what happens? There are a list of things that will happen when the cyst ruptures. There's bleeding.
Okay.
So a lady can come in bleeding. That's bleeding internally.
Yeah.
And that's not so good. So there's increase in blood, decrease rather in blood pressure. Then there's an increase in your pulse rate.
Okay.
All of these are telltale signs that the person can run into shock.
Okay.
And when the person goes into shock, you now start to have to resuscitate the person. And if all of this is not done quick, then the person can die. And then cysts are cancerous. Obviously, we know how cancers are, and how they can progress very fast. But then having a functional simple cyst on its own doesn't really pose any harm, because a lot of them resolve on their own. So, and most commonly those are the cysts that we get, the functional cysts, that are really simple and then they resolve on their own. But it's just to note that some of these cysts can be cancerous, but not to just scare you.
Because I remember when I had mine a couple of years ago, and I went to the hospital and I was diagnosed that I had ovarian cyst. I was so scared.
I can imagine.
That was the first time I was hearing ovarian cyst. And then the first thing that came to my mind was, is this cancerous? Like, do I have cancer? Is it going to lead to cancer? I was so scared. In fact, I didn't even think the medication that I was given was going to work because of how scared I was. And I feel like a lot of women are actually like that. They are scared. Some even have it, but they are scared to go to the hospital, so it doesn't escalate. They feel like going to the hospital is going to escalate it. That is what is going through a lot of people's mind. But now, how do you know you have ovarian cyst? What are those common symptoms that will just make you realize that I think there's something wrong with my ovary, I should go do a checkup? So what are those common symptoms?
So ovarian cyst most times is always peak incidentally. Most of them are asymptomatic, that you don't have symptoms, so you might have a cyst and you don't have symptoms, and then it will resolve on its own before you even know you even have a cyst. So a lot of them are peak incidentally with an ultrasound scan. But then some have symptoms. So symptoms would be pain, and this pain will be sharp, sudden, and in the pelvic region, just where your ovaries are, and it could be on either side. It could be unilocal, that's on one side, or you could just feel the pains on either sides. And then some other people will complain of irregular menstruation. And then some other people have vague symptoms, constipation. Some people have epigastric pains. So the symptoms might look like any other thing. It can even look like a pelvic infection. So it might look like that. So most times it's really picked from when you go and do a scan, then you say, this is a cyst. So you will now realize that you have a cyst. But basically you cannot just feel yourself and say there's something there, you're feeling it, except the cyst is really very big. Then you could feel something really hard at your pelvic region. And then for the cysts that can be cancerous, those ones would be mostly at the advanced stage. That's just the disadvantages. Just at the advanced stage, then you now start realizing that I'm losing weight, my tummy is getting really big, I have difficulty in breathing, shortness of breath. So basically that's it.
So now, if I am suffering from ovarian cyst, can I get pregnant?
Yes, well, it depends on the cyst, right? You have your, like I said, functional cysts. Those are simple cysts. So you could actually get pregnant with some of the cysts, and they resolve on their own. And then, like the cyst I told you about that occurs during pregnancy, obviously that person has already gotten pregnant and then has a cyst, so you could coincide with pregnancy as well. But then there are these cysts, the polycystic ovarian cysts. These cysts really are the ones that actually affect pregnancy. There are several tiny cysts that originate from the ovaries, and this can tamper with menstruation, blood flow, and all of that. And then patients normally find it difficult to conceive. Most of these women are sometimes on the big side, so we say reduce your weight. Some of these things help to resolving some of the cysts, and then they can take in. So it's not every cyst. Simple cysts don't have any problem. You could take in. So it's when you have the polycystic ovarian cyst, and those ones actually have effect on you taking it.
The reason that I asked is because I've heard a lot of stories. A lot of women close to me have spoke about how they suffered ovarian cyst and then they had to undergo surgery before they were fine, and before they were able to take in.
So that will lead us to treatment. How to treat ovarian cyst.
We are getting there.
But then simple cysts, like I said, are really small, so they wouldn't require surgery. But it's when the cysts have grown really very big, like bigger than like 5, 6, 7, 8 centimeters, then they are worrisome. And then some of those cysts are symptomatic, so they'll have to remove those cysts. Some of them grow so big that they will interfere with different structures. They might occlude the fallopian tube, as in passages where an egg should go through the passage and then implant in the uterus. So those type of cysts have to be removed, so that you have space for your baby to grow. So
so which is why checking up on yourself once a while is very crucial.
Very, very crucial. Very, very crucial, especially when you notice that there are some irregularities. Some people just feel, I didn't see my menses this month, I didn't see it last month, my menses are not regular. It's not normal. Your menses should be regular.
It's not normal.
It's not normal. Some of these things we just take casually, but then we should actually go and check up. If you're having irregular menses, go and check up. If you're having pain in your pelvic region, go and check up. It might not be a cyst, it might be a pelvic infection. And then when it doesn't get treated, then you now start having problems conceiving, and you say you're complaining, but then you had this you had these telltale signs and you didn't do anything about it, or you were scared, or you sat down. I said, I don't want anybody to know I have infection. I don't want anybody to know.
It's not shameful to have infection.
It's not. Just go and have yourself checked.
I swear, if you see the messages I've received about this, people are asking me, and I just feel like talking about my experience alone is not going to cover it. I know so little on ovarian cyst, so little. I'm not a doctor. This is why I brought amazing Doctor Dooshima here to enlighten us more about it. So now, should we go to treatment?
Yeah, we could. Well, it would just be the risk factors, that will predispose you to having ovarian cysts. And some of them would include infertility. Like when some ladies are infertile, this one is a big one. I have a lot of patients that will call you and say, I can't give birth. Is there any drug that I can take? So some people want to self-medicate. And in doing that, they go and get these ovulation induction drugs, and then they just take them. You're taking them without knowing how to take them, and this can cause hyperstimulation of the ovaries, and then you now have a cyst. So those drugs that you people like to take, will make you have to have a cyst. Then cigarette smoking has just been tied to different bad things, and I don't even understand, why would you as a woman want to smoke, But then smoking could even be passive. You could be just sitting down next to someone that is smoking, and you are inhaling the bad part of it, So smoking also has been tied down to ovarian cyst. So like, these are things that can actually worsen ovarian cyst. Yes.
So I heard a lot of people say they had ovarian cyst and they took maganin gargajia. That's herbs. Like you just said, you cannot afford to take medication. Don't self-medicate.
Some of these cysts resolve on their own, and then you'll be feeling like, is this maganin gargajia that worked? It didn't do anything. The cyst just did its time and resolved on his own without you doing anything about it. So don't self-medicate. Self-medicate.
So what is the treatment of ovarian cyst? What are those treatments?
Well, treatments would include using some contraceptives. Well, I would not say which contraceptives so that you people will not go and buy it and self-medicate.
Yes.
And so go to the hospital. Let me just even say this: go to the hospital and have yourself checked and see a gynecologist so that they can prescribe the drug to take in the right way to take it,
yes,
and how to take it.
Yeah.
So it's better that way. But then treatment will include taking drugs and then surgery. Yes. And then the surgery would be for big cysts that are giving you problems, that are mostly symptomatic. They're already giving you problems. Yes. So they will be taken out. Like I said, some of this is resolves on their own, so you might not necessarily need to take anything. And then sometimes, you know, we give pain relief, especially for those people having symptoms. They have pains that are really, really excruciating. We give pain reliefs, and then we watch. We keep on doing scans, serial scans, just to watch and wait and see if it's resolving or it's growing bigger and bigger and bigger. Then we take action and say, we need to take action. Then for those that we see that are not so simple, they're a bit complex, they're a bit cancerous, then we now do further tests to find out, if this is cancerous, do a biopsy and then check, and then, you know, further on have it removed or you start taking cancer drugs. Yes.
The reason I ask is because most people go to the hospital and then they're given drugs and they are being told to come back after a particular period of time,
and they don't.
But because of stubbornness, I don't know if it's stubbornness or they are just not, I don't know, maybe they don't just care about themselves or so, but they take the drug and then they don't go back to check on themselves. They don't go back for another scan.
True.
How do you know if the cyst has
resolved on its own? If you miss your follow-up visits. Yes.
So even after taking medication, you have to go back to the hospital for checkups.
Yes.
You must. You cannot just assume, okay, I'm taking drugs and that's it.
And that is it.
Nah.
Sometimes this cysts don't resolve. Yeah, the drug they might have given you might just be a pain relief.
Yeah.
The doctor might just give you a pain relief and say, let's watch and see. Come back for another scan, and then you fail to, and then the cysts keep growing and growing and growing, bigger and bigger and bigger, up to the extent that we say we want to yank it off. Or in case the cyst might just be a complex one and be cancerous, and you sit down at home and you do not know. You know, most times cancers, when they are picked early, you know, you have good prognosis. But once the cancer is advanced, you know, prognosis is really not good. You know, your outcome will be really bad. So it's better to pick some of these things very early so that you attack them early, and you know, you have good outcomes.
Okay. Because I feel like 2023 is our year of being intentional. You know, our health, we have to take care of ourselves for the sake of our children, for the sake of our own self, for the sake of our husbands, for the sake of our family. If you're not married, for the sake of your parents, you must take care of yourself. And that involves you checking up on yourself, going to the hospital. When you have any symptom, go to the hospital for checkups.
Don't always calling doctors. Stop always calling us.
You won't go, but you call. WhatsApp.
Yes, through WhatsApp.
Yeah, through phone call. Doctor, this is the way I'm feeling. What should I do? What should I take? No.
Sometimes some of these things cannot just be picked from phone calls. You have to be examined. You have to touch.
No, we see doctors as God. Don't blame us. We see doctors as God. So that's why we call and WhatsApp and we are asking, okay, doctor, this is how I'm feeling. What should I do? What should I take? You want doctor to tell you on phone what you should take, which is very, very wrong. You have to go to the hospital. You have to do your checkup. You have to do your scan.
Very important.
And when you have been diagnosed with any ailment or infection or ovarian cyst, you must take your drugs as prescribed. What is it? What is it, baby? Baby, I'm not done. Hey. Nothing they do, Amu. Nothing they do. I just want to see you. Hey. But you're with daddy now. I think you're with daddy. Eh? You're with daddy. Daddy. Amu.
That boy wants that boy, you go give him my money, go.
Give him. Abi how?
Give him now.
Can I give him?
Yes, sir. Yeah. And good though. My husband is still here, so
Okay.
I'm stuck here.
Now for baby, you did.
Hi guys. Hi guys. So we want to take a break for Jason to eat.
You are not even confirmed.
patience.
You have taken any position you want now.
So our video will
When
continue.
he
shortly.
stand.
Stand.
We interrupt this video. Hi guys. We interrupt this video
Transmission.
to bring you.
Transmission interrupted.
This is a commercial break. Please bring mice. Let him eat too. Yes, let him go for
Is
commercial
he
break.
crying?
He's crying.
Of course, he'll be forcing out. We interrupt this program to bring you. Say hi.
Maybe I mean the
Say
video
hi
on
and
the
show
breast
them.
is just showing them.
Yeah. Yeah. Show him
Hi
your
guys,
new hair.
you're welcome
Jason,
to our YouTube channel.
why is Jason just
Thanks for
forcing?
having here. If you're an old-time subscriber, thank you so much for sticking around. If you're a new-time subscriber, you're welcome.
You're welcome.
Welcome.
Jason.
This is our son, Jason,
Okay.
our baby boy.
Okay.
So, in conclusion, ovarian cyst is not as deadly as we make it in our head.
Yes.
Yeah, it's not as deadly as we make it in our head. And now we can vibe. Please, Doctor Dooshima, conclude. Doctor Dooshima, conclude for us.
So in conclusion,
Yeah.
ovarian cyst is not as deadly as we think it is. Go and get yourself checked. That's the important thing. If you
Yeah.
notice any irregularities in your menstruation, if you're feeling pains, just go get yourself checked. That's the ultimate. Don't always want to call on phone to receive medical.
I don't hear back.
Get yourself checked.
Yeah.
That's very important.
Yeah.
Mhm.
Don't go back home and go and take herbs. Don't go back home and go and self-medicate.
Mhm.
You're making it worse. Go to the hospital and get the right treatment
True.
for the cyst.
True. True.
So, if you enjoy this conversation,
Yeah.
don't forget to like,
Mhm.
comment,
Yeah.
and subscribe to our YouTube channel. Thank you so much for sticking around. See you in my next video. Bye.
Bye.